having affordable, accessible health care is one of the most, if not the most important thing in their life. And we also know that under the Affordable Care Act, under Obamacare as it has been called, millions of additional Americans were afforded the opportunity to have health care in our country, in our state, and most importantly for me, in our city. But we also know that President Trump has made an attack on Obamacare and the Affordable Care Act one of the hallmarks of his presidency. He might want to dress it up, but he loves talking about how much he hates Obamacare. But what he hasn't talked about, and what he hasn't done at all, is offered anything to replace it. So we have a situation where millions of Americans who suffer from pre-existing conditions are at peril if President Trump and his followers carry through with their plan to eliminate the Affordable Care Act. And this is not just idle chatter. His administration is actively, through the Justice Department, supporting litigation that would strike down the Affordable Care Act. Now, there's been some back and forth between him and Mitch McConnell about the timing of this, and now they're saying, well, we're going to put this off, and we're going to come up with the replacement plan after the election. This is after 4 years of attacking affordable care and saying that he's got a replacement. We've never seen his replacement. We have never seen his replacement to the Affordable Care Act for one simple reason: it doesn't exist. So Americans need to know, with all the noise, with all the chatter that is going on right now in this country, that healthcare is first and foremost an issue that we have to focus on. And I'm proud that the people behind me understand this. I'm proud that Ben is here to talk about this on behalf of the Democratic Party, because this is one of the issues that clearly separates the parties. The Democrats, all of the Democrats who are running for president, support the Affordable Care Act and support the ability of people who have pre-existing conditions to continue to get care. On the other side, you've got attack after attack after attack, and no replacement at all on site. People have to realize what's going on. Ben, I'd like you to talk about it, and thank you for your leadership on behalf of the Democratic Party.
Thank you so much, my friend. I'm Ben Wickler. I'm the chair of the Democratic Party of Wisconsin, and I'm here today both as chair and also as a father. I'm one of the 2.4 million Wisconsinites with a pre-existing condition. When I was growing up here in Wisconsin, my mom would wake up in the middle of the night to hear me gasping for breath because I had severe childhood onset asthma, and she'd rush me to the emergency room. And as I was growing up, my mom would tell me, if you ever leave a job, make sure you have another job with healthcare benefits lined up first, because you'll never be able to buy insurance for yourself because of my pre-existing condition. Now, after my son was born, I had that same terrifying experience, the experience no parent wants, where you hear your child desperately struggling to be able to breathe. My own son has asthma as well. But I thought I was at least free of the fear that he would not be able to buy insurance because of his pre-existing condition, thanks to the Affordable Care Act. And then Donald Trump was elected. Donald Trump promised two things in his 2016 campaign. The first is he said he would make sure that everyone had great health insurance. He said he would bring down the cost of prescription drugs. And the second thing he said is that he would repeal the Affordable Care Act on his first day in office. He broke his promises. And from day one, he's been attacking protections for people with pre-existing conditions, trying to destroy the Affordable Care Act while lying through his teeth about his real plans for healthcare. We can see now that Trump intends to double down. Donald Trump is the #1 threat to pre-existing condition protections in the United States of America. And he is lying about it. But we know in Wisconsin that when Republicans talk about pre-existing conditions, they are saying one thing and doing another. We know Republicans are attacking our health care, and we know that Wisconsinites know this because Democrats won every single statewide election in 2018 on the strength of the issue of health care. Millions of Americans stood and fought for their protections, for the protections of people in their communities, and we stopped the Republican assault in Congress on our health care. Now Donald Trump is trying to take away our healthcare protections through the courts. And just like our victories in 2018, we are going to stop Donald Trump from being reelected here in Wisconsin in 2020. because we are going to fight for healthcare instead of against it. I want to thank everyone who's here today, all the people across the state and across the country who are fighting for protections for people with pre-existing conditions, fighting for the idea that every person deserves healthcare as a human right, instead of fighting, like Donald Trump, to take away our protections. And I want to thank all of those who played a role in ensuring that so far the Republicans have been unable to succeed. We're going to expose Donald Trump's lies, we're going to remind people of his broken promises, and we're going to make sure that no parent and no child ever needs to fear that they won't be able to get health insurance coverage because of a health condition that they have no control over. Thanks so much. We'd like to welcome our next speaker, Stephanie. Yes, healthcare advocate.
Thank you. Hi everybody, my name is Stephanie Stein. I'm a member of the League of Progressive Seniors, and I've worked with seniors in this community for 45 years. I've seen the incredible things that prescription drugs can do to make people's lives better, but I've also seen the dread and the grief that comes over people when they can't afford those drugs. Instead of a rally over at the Panther Arena, I wish President Trump would spend an hour or two standing in line at Walgreens or CVS and watching what happens when people are told about how much their drugs are going to cost. There is grief and horror expressed at those counters every day. This is my inhaler that I have to use for asthma. 3 years ago, my copay on this inhaler was $25. Today it's $75. For no reason. It's the same thing, the exact same medicine. Last year at this time, my brother was hospitalized with Legionnaire's disease and developed atrial fibrillation. His doctor prescribed a medication for him to take when he got home. But before he left, the social worker showed up to ask him if he knew that the copay for that prescription could be as high as $1,500 a month. No, he didn't know that. And she went around trying to find a way for him to afford it, which she did. But that's how social workers are spending their time, trying to help people afford drugs. This is crazy. President Trump promised to lower the cost of prescription drugs. Have they lowered? No. They're costlier and the drug companies are making more profits. President Trump could fix this in a big way tomorrow if he supported the House of Representatives' lower drug cost bill, which passed the House in December. This would allow our government to immediately negotiate with Medicare and private insurance companies to lower the cost of drugs for everybody. But no, instead what do we see? Higher costs, more commercials, and obscene profits going to people who don't give a damn about if people are well or not. President Trump, we need you to do something about this, or we need someone who will do something about it. Thank you. Yes. My pleasure to introduce Tom Palzwitz.
Thank you. That was great. I'm Tom Palzwitz. I'm running for Congress in the 5th Congressional District, and I think everybody here has a healthcare story. And the common denominator between all these stories is one thing. Our healthcare system is broken. It doesn't work for the people who don't have insurance. It doesn't even work for the people that do have insurance. I've met so many people over the last couple of years who say, Tom, the cost of my co-pays and my deductibles continues to go up, and at this point I'm considering whether I should even go see a doctor or a medical professional for the things that I need to take care of. The bottom line is this is something that I personally believe is a universal right, not a privilege. And we need to move in this country. We need to move to a universal health care plan that makes sure everybody is covered so that we can get a lot healthier as a country. And more importantly, this has a lot to do with the economy. Wages aren't growing because the healthcare costs are rising. People aren't able to move jobs because they're stuck in a job they don't necessarily even like just for their health care. And the bottom line is people are filing bankruptcy and people are dying because our healthcare system doesn't work for the people of this country. So things have to change. And right now we're going to have a president that's going to show up at our doorstep here who's going to talk about taking health care away from people. that is the wrong path, and it's the wrong message we need to be sending to people, because one of the underlying fundamental things about our economy and our society is we take care of each other. So the bottom line is we need to start moving on healthcare, and we need to make it accessible and affordable to everyone. So I just want to thank everybody for showing up today. Appreciate the mayor coming and Ben coming. I think this is one of the most important, crucial issues that we have in our country, and we need to start solving it, and we need to solve it now.